Hi, I'm Tony. This is kind of an introduction to what I'm trying to achieve. I couldn't really make one 5-minute pitch about what we're trying to do, so split it into three. But at the start, there's a little bit about me that we just found. There's an animation. Uh, yeah, animation, yeah, just have a quick look at that. But it shows when I made the app about 5 or 6 years ago. And the other one is at the start is on YouTube Shorts, and it's from a patient that I met about a year ago. And what I did for him, I should never have done. But it lasted quite a long time. So see what you think. We need to do things slightly differently. And yeah, we can't leave it just to the academics. An awful lot of what's been done in dentistry that's been worthwhile has been way outside the academia. Anyway, have a look. I've put a timeline for everything on it and get back to me. Bumped into an old patient. We're all old now, on the Downs, and anyway, this is quite an interesting story.
Hello, my name's Clive. I was a patient of this man 30 years ago. He did a bridge for me, which he told me would only last 10 years. It lasted 30 years. So I've only just had it removed because it needed removing, and I've decided to go for implants, which are going to cost me £6,500. But I was offered to have a tooth stuck on either side, which I decided not to do. But if you look at the top of my mouth here, that one is stuck to the other side, which this gentleman did for me there, and that's also been there for 30 years. It's caused me no problems whatsoever, so I recommend it.
To take back control of your health, download and personalize the free Teeth for Life app. It has lots of useful animations explaining different dental treatments and how to prevent them. This one explains Clive's bridge. And the best way is actually just to glue a tooth onto an adjacent sound tooth. And these have been done for many years and are extremely successful.
As we all know, teeth are a very important aspect to our lives and our health. Obviously, gives us an amazing bright smile. And I am here today talking with Tony Smith about keeping that smile nice and healthy. And you have a brand new app you've been developing. First off, how do we go about downloading it?
Well, it's available on the App Store for the iPhone and also available on the Android. Once it's downloaded, it will come up like this, and you press Squeeze Me, and that'll bring up a video explaining how you, as a user, can use the app. So the idea behind it is obviously, as we know, prevention is better than cure, and the best thing you have is what you're born with, which is your natural teeth untouched. In an ideal world, we want them left untouched, and the app is all about having minimal treatment and making it, if you've had any treatment, making that last as long as possible. As a user, you can personalize it yourself, so you take a picture as you do with lots of other apps in case you forget who you are. You can use a smile if you want, and then you'll get the details from the dentist, and then it asks you your risk factors, which these risk factors are just the normal, like smoking, drinking, diet, just 6 risk factors that you fill in, and then it brings up a scorecard and shows how likely you are to lose your teeth early, and it also shows your risk of oral cancer. So it's 2 things really.
So it's like a personal trainer.
It's like your personal trainer for teeth. So that's what we say, and we always say like your hygienist in some ways should be viewed as your personal oral health trainer, but it serves as a way of filling that gap where we should be providing more prevention advice. The best thing you have is your natural teeth, and it's prevention. So as a dentist, what I've tried to do is create something that actually is free for the public and gives good advice, and hopefully reduce dental costs, reduce the time at the dentist, and this is just like your individual treatment.
So I've been trying to promote prevention for many years, but ultimately what I have to do is to show the profession how it can make them money. So I've tried everything with prevention. Back in the day, there's a Cavimed, I've used ozone, and I even moved my premises so I could provide a health service. It's all here on the teethforlife.org website. Paid to give a talk on prevention at a dental show, but nobody came. I had more success with the Digital Dentistry Symposium. And these are some of the things that I'm interested in. I was on the LDC for 25 years, but getting the profession and the GDC to collaborate is a struggle. But we should do this. We should collaborate. It'll make all our working lives easier. So there's a problem with care homes and access there. And the idea is to make it financially viable for people to go there. And that can be done through 3D printing of dentures. And we've done this. And the consequences are a lot worse than just losing your teeth. But while they're there, they can support the oral health champions in care homes. I first demonstrated this about 5 years ago using an iTero scanner that cost £30,000. And then last year, with help from UE, I demonstrated it using a domestic scanner for £500. So our online portal will help the elderly who want to have either new or replica dentures made using dental scanners and 3D printers for a quicker and cheaper service that the current method doesn't provide. So this is a simple spreadsheet, but it really is quite simple with regards to the sums involved. According to the government, 14,000 dentures go missing in care homes every year, and the Dental Health Foundation say there are 30 million dentures in the UK. We just need a way to promote the service to the public, as on this page that could be added to my current app or to a new website. And this spreadsheet shows the difference in hourly rate for the dentist and the business if we use 3D printing. And the different processes can be seen here. The price of the hardware has come down considerably in the last few years, and the dentist doesn't need to do the scanning, the nurse can. While many dentists have these scanners for adult orthodontics that makes them a lot of money, there are lots of other things that they can be used for that are of benefit to the most vulnerable members of our society. So while it's possible to print dentures at the practice, it's not really cost effective. Nearly everybody will use a lab. And these labs can be very profitable, as you can see from the figures here. So if you empowered some dental nurses to go around care homes, scanning dentures, scanning teeth, and giving support to the oral health champions, we could end up saving a lot of lives, as well as saving a lot of smiles. And this lab in Ireland have done it already, and I've done one. I did one in Bristol in December last year. I've failed trying to market my app to the profession, but I think we can market it to the public, and then the dentists will follow because it will make them money. Any dentist who's on our platform has a scanner, they can be found through our app, which will have instructions on how to upload the file from the scanner, either by the dentist or by the user. Outside the NHS, dental practices can charge what they want with regard to making a copy denture, as can be shown here, or a reline. If you do a digital reline, you also end up with a spare denture. So you have a new, better fitting denture with brighter teeth, and you retain the old one as a spare. So through the website and through a dental app, we can promote a dental health service free at the point of contact. But it's never happened because who am I? These are my notes from 2017. I knew then that no one would listen to me unless I had some endorsement, but that's not forthcoming from the health service, even though all the video advice within the app follow the government's own guidelines on delivering better oral health. I've only put figures down for copy dentures, but these are more lucrative. There are lots of different types of dentures that we can make. The data from scanning will never change, and these are all different things that we can make. And this is interesting. This product's being launched in May this year, where I hope to be at the dental show. That's how many people they order them for their partners. The advantage of an app is it can be customized by all the dental team and personalized by the user. But in effect, what we will have is this number of health advocates. We don't need to know everything that's actually within the app that's been preloaded. It can have other trustworthy resources and signpost people to where they need it. To be successful quickly, it needs funding, and the main area it needs funding is in marketing. And rapidly, it should become self-funding, and then we can really help one another. So this is the platform that we'll need in order to generate an income from the 3D printing, also from teledentistry, and also from basic sales. So this is the current website that I made when my dad got dementia, and I added a section for carers. It's better viewed on the mobile. So there's the website there, and then there's part of the app that the user can use to show how likely they are to suffer with anything. But what I'm left out was a page to make an income other than the registration of dentists. And this is where rebranding can really help. Everything you see I've done. However, I know this is something I struggle with. The app especially needs some help with product design, not for what I think's best for the user, but what the user is happy to use. Started to rebrand the YouTube website, and the ones with the cross on you can't find anymore, but they will be on the dental health service platform, but only for the DCPs or the health professionals. The current app was made mainly with young dentists in mind to try and support them. Far too many of them giving up. However, but we can also make the app for practices, and in doing so we can also make them a website at the same time as we make them an app, and aim to consolidate the video libraries and the video resources that I've made up all in this dental health service platform. And it's anticipated that anyone who's a better social media presence than myself, which includes a lot, then they may well promote the app as well, and that's the idea. And I've repeatedly been told I need to spend money on Google ads and study the analytics and play around with the SEO. But also we can do this, which is just marketing videos in doctors' surgeries. So I'm talking to someone in May about this, or just using QR codes, which I tried to pass off to Sainsbury's and to Boots, but with very little success. I'll be able to reuse a lot of the better videos within the new frames, such as TikTok, and get someone else to do it, hopefully. I spent a lot of time and a lot of money with Orca, proving that this isn't a medical device. The dentures are, but they'll be covered. But what I need is some support with regard to endorsing and promoting the product. Everyone's too worried they'll get into trouble. It's 6 years since the app was made, and it's actually, we've now got swiping and pinching and all kinds of different things that we could use. However, it needs rebuilding, well, rebranding, and these are the figures that I've spent. I can't afford to do it anymore on my own. So this is a spreadsheet showing what the income could be with some early adopters who started using the product, or at least funding it, before we added the 3D printing and the teledentistry. And the vast majority of dentists would like to be seen to be supporting our health service, even if financially we're being excluded. There's an awful lot I've learnt since I first made the app, and I do know I need help with the product design. I need to know what a user would use rather than what I think they'd use. When it comes to launching a new product, you need twice as much money as you generally do for actually producing it. So these would be the kind of figures we'd be looking at. But very soon it'll be self-funding. It may be that I just need to pay a recruiter to get in touch with all those that have registered on the app and just get them to pay. As early adopters, they could keep the app at the same price for the life of the app, which hopefully will be many years. I'm very much reliant on the goodwill of a few people, and these are the ones I'd like to fund. To make full use of the AI, we need this extra hardware. So for the website, well, it's unlimited what you can put in. We just need to structure it so it can be found easily enough. And when it comes to the app, the videos can be improved. They have to be under 2 minutes. Through collaboration, I can improve the text, and through AI, we can have it available in any language for a fee. So this is frustrating. We should really have learnt our lesson during COVID, but it's gone very quiet with teledentistry. So these different groups highlight the problems. It's climate change and sustainability. The health service is running out of money. I think this is where I can help, because they promote all the services and all the evidence from this group. So these are some of the courses I went to over the last 6 months. The one on sustainability is still doing the rounds. And so what I'm trying to do is to help these bodies, the Royal College of Surgeons, the report in The Economist, and the British Association for Study of Community Dentistry. I'm trying to do something rather than just talk about it. The government talk about an integrated healthcare system, but dentistry is being pushed outside it, even though they now reckon 57 diseases are directly linked to the biofilm in our mouth. When it comes to improving health, we need to follow the advice of Rory Sutherland or Matthew Syed and avoid these echo chambers or thought cages. And with regard to continuity probability signaling, well, we all know what that is. Well, I know what it is now. So this is on the Royal College of Surgeons PDF. And as we can see, the vast majority of CO2 emissions are due to transport. And so I asked at the meeting if we were doing anything about teledentistry, because it follows everything that they want. I even sent in an email. But the advice I was given was there's no funding for teledentistry. Why didn't I do it myself? So please, fund me. About 30 years ago, I heard an Australian talking about how he worked a 3-day week with 3 hygienists and earned more money. I didn't believe him. I believe him now. We need to change the way that we practice. And it's all written down here. Now this may help. The government are funding these apprenticeships, which I think is a great idea. It'll empower other members of the dental team to do routine things that, quite frankly, they're better at than we are. While lots of patients are scared of dentists, it seems to me lots of dentists are scared of their patients. It's very difficult to learn soft skills. As for everything else, we've got Google. Google isn't ideal, probably better than Facebook, but the best thing would be if your health professional recommended a product for them that they themselves endorsed, or even better, contributed to and collaborated with. So as on the current app, any dental health professional could customize it for themselves and also promote products that they're interested in, or even be found on the teledentistry platform. I've got products at home that I think we could show people how to use through the phone. We just need to practice on one another, using the freely available encrypted video resources, and even potentially letting the user use their own intraoral camera. Initially practicing amongst ourselves will iteratively develop a great product for the public, and we can also follow the advice of these people who've made a great deal of money using a bottom-up approach, and the main thing that they recommend is this. There are lots of great products out there. I'm about to trial this toothbrush in care homes, but the reason I put the slide up is about the health advocates. It's not my idea, but it's one from Marion Nestle. We just need to widen the field and widen the actual scope of the dental health service. I've made lots of videos on this, and they can be found on YouTube at the moment. If you type in copy dentures or you type in SDF, then it'll bring out a few interesting videos on what we could possibly do, especially with this new apprenticeship system that's being brought in that can really empower dental nurses to go into these schools as well as care homes. I've been promised the silver diamine fluoride for the trial, and also I'm pretty sure I can fund this through an engagement with a national company. But I need to do a pilot. I can only find a couple of people who have an interest in this. The diagram on the right is from Clayton Christensen, who talks about disruptive innovation in health, and that's what we need to do. I've even made a video on it from where this was taken. So if you type in Bridging the Gap, you'll find that. I sent it to Dominic Cummings. That must be about 4 years ago now. All you need is probably a stand for your mobile phone and a few other items that are really relatively inexpensive. And for those that help perfect the system, well, they can have the app for free. There would be an explanation of how they can get paid directly by anyone they were given advice to. And of course, they can be found from anywhere in the UK. This is definitely a course that lends itself to online learning, and we just practice with one another. We just need funding to kickstart a system that'll work for everybody. There are probably quite a few retired therapists and hygienists who could do with a little bit of extra money, and another incentive for those that complete the apprenticeships, because it'll help supplement their income.